Hello, everyone. A very warm welcome on behalf of the whole Citrix team, Nutanix team, as well as our customer, Delaware Valley Community Health. Today, I bring you a very exciting webinar. But before that, let's run through a few housekeeping details. My name is Rubal Walia. I'll be at the back end of this webinar. So in case you face any issues logging into the system, audio issues, etc., please feel free to type in your questions in the chat. In the Q&A panel on your GoToWebinar interface, please, and I'll try and help you out. This webinar is getting recorded, and you'll receive a copy of it in the next 24 hours. Now, moving on to the webinar, we've done something very exciting today. We've brought on a customer on this webinar, and you'll get to hear exciting things about how this customer is using the combination of Citrix and Nutanix technologies. And if you work in a healthcare space or in a public sector space, is how you can replicate the success that our joint customer has done for us. So without further ado, let me first bring on our key speakers for the day today. Guest of the honor today, obviously our customer, Isaiah from Delaware Valley Community Health. Hi, Isaiah. Good morning. Do you mind coming up on camera, introduce yourself?
Good morning, everyone. Isaiah Nathanial. I just happen to be Vice President and Chief Information Officer for Delaware Valley Community Health. But before I get into all of that, I just want to say thank you for joining. I want to thank my good strategic partners, Citrix and Nutanix, for what they have done not only for us, but for the 50,000 patients that Delaware Valley Community Health see annually. So Delaware Valley Community Health is a 52-year-old federally qualified health center. And for those that don't know what that means, all that means is that we see anyone with, regardless of insurance status, you can have insurance, we'll see you. If you don't have insurance, we'll see you as well. And what happens is through our 9 locations in Philadelphia, Pennsylvania, for traditional primary care, that's internal medicine, adult medicine, pediatrics, MAT, behavioral health, women's health, OBGYN services, we see about 50,000 patients, again, about 158,000 visits per year. And what happens is through our HRSA 330B grant funds, regardless of your insurance status, we're made whole on that visit. So I'm just excited to be here. I'm looking forward to the conversation, and I'm happy that we get to talk tech today. So Rubal, I'll turn it back over to you.
Thanks, Isaiah. Lovely to have you here as well. And next up, my colleague and good friend, Alan.
All right, thanks so much for that introduction, Rubal, and a very good morning, good day, everyone. I'm Alan Formansky with the Citrix Technical Marketing Team. I've been at Citrix over 14 years across a wide variety of roles, from product management to readiness and alliances. And in my current role as a lead architect and content strategist, I look after our TechZone platform. Hopefully, many of you are familiar with that platform, techzone.citrix.com, where we have everything and anything technical related. This is technical videos, reference architectures, deployment guides, you name it. My specialty area is DAS and VDI solutions, and I'm based here in sunny South Florida. And yes, it is actually still sunny at the moment. So really looking forward to the discussion, and I think we'll bring on our next guest for the day.
Awesome. Yep. And if you've been in the EUC space, specifically in Citrix and Nutanix technologies, I'm sure many of you have already heard of Jerian. But Jerian, do you mind giving a quick introduction to audience who may not have heard of you?
Hello and good morning. My name is Jarian Gibson. Thanks for having me on today and looking forward to the chat. I work with Nutanix. I am in EUC engineering. So I have a similar role to Alan, where I do things like our reference architecture guides, our best practices, our newly released Nutanix Validate design, and I focus primarily on Citrix on Nutanix. I am based out of Kansas City, and I'm just over 4 years at Nutanix, but I've been doing Citrix since the MetaFrame 1.8 days. So a long time working with Citrix in different roles over the years.
Awesome. Thanks, Jerian. I'm looking forward to hearing this conversation more than our audience are. Awesome. Before I fade into the background, just one quick slide that I wanted to share with you guys about Citrix Ready. Many of you may have already seen this. As Citrix Ready, what we've been able to do over the years is really create an ecosystem of technology partners that gel very well with the Citrix software stack. So in case you're looking at any third-party technology to run on your Citrix software, please feel free to visit citrixready.citrix.com, and you'll find thousands and thousands of products in each category that you can explore and then make a trusted and advised choice. As promised on some of the mailers, this webinar is running a promo. So every 10th attendee on this webinar will receive an Amazon Echo Dot. And please stay till the end of the webinar, and I'll tell you how you can claim your gift. With that, let me hand it over to Alan to take it on, and let's initiate our fireside chat. Alan, over to you.
Excellent. Thanks so much for that, Rubal. And again, a very warm welcome to everyone. Really appreciate you spending some time with us here. I think we're going to have a fantastic conversation. All right, so Isaiah, you kind of mentioned a little bit about your organization and fantastic mission and charter. Perhaps you can give us a little bit more background about the organization and the role that you play at Delaware Valley Health.
Yeah, I'm happy to go into a little more detail about that. When I initially started to talk about this, I talked about FQHCs, community health, and we fall under the healthcare industry of a federally qualified health center, but we're only one of many across the country that serve about 29 to 30 million patients per year. Delaware Valley Community Health, home of the Philadelphia Eagles, home of the Philadelphia 76ers, home of the cheesesteak. Our imprint in the community health space is about 50,000 patient lines, again, about 158,000 visits. And so a federally qualified health center means that our charge is to serve the underserved. We're strategically located in underserved communities, and we offer services to them that they may not have gotten anywhere else. And we're typically in a traditional primary care space, but we have some subspecialties that we offer as well. That's where we get into the MAT services. And then our referral partners are the Temple in Philadelphia and Jefferson University and Jefferson Hospital. And we also train residents in Delaware Valley Community Health. So us as an organization, we consider ourselves a part of the continuity of care for all of our patients. We play a strategic role with our hospital partners, and a lot of our job is to prevent ER utilization, and we take our charge very well. And we really get into the social determinants of health. I know we'll get into that, but if I don't have a system, if I don't have technology that can support all of these lives that we have in our actual care, but then as we refer them out, then I fail at my job, which is Vice President and Chief Information Officer. And I just happen to be here, been here for 15 years. So I always get excited when I get to talk about Delaware Valley Community Health and the great work we do in the community.
That's just amazing. That is amazing. So yeah, let's go ahead and talk tech. And I understand that previously you had somewhat of an aging IT infrastructure that was posing challenges for you, your team, right, and your broader organization. Can you talk to that a little bit and sort of what the intention was behind really upgrading and modernizing your infrastructure?
Yeah, that's a great question. And I preface this by saying that we've been a Citrix customer for decades, and we've been a Nutanix customer only since 2019. So if you marry the two conversations together, this is where we get to what the special sauce, I think, is what we're talking about today, is the partnership and the relationship between systems and infrastructure, hardware and virtualization stack, including the storage, because we're on AHV with Nutanix. I think that is where we decided that we needed to do something bold and do something big. So let me set the stage for us a little bit. We were running an EHR application that has many different modules to it. And I won't get into all of the modules, but anyone listening know how bloated an EHR application and the auxiliary modules could be. And this was running on physical hardware. Well, we were still using Citrix as an application layer, but we were getting to the point where the costs were rising. We were getting to the point where the IOPS for the database connectivity was getting to a point where we were taking 5 minutes just to prescribe the medication. Now you put that into context with 79 providers that we actually employ, you put that on our entire system, that was stretching us completely thin. And so I had to sit down and I had to take a real hard look at our entire infrastructure stack. And that goes all the way down to the storage. And I said to myself, we can't keep functioning like this. Doctors are ready to quit. Our staff is ready to quit. I am not having a good day at work. And so we said we had to go bold or go home. So to put that in further context, I come from an athletic background, and one of my favorite basketball players is Kobe Bryant, and he has this Mamba mentality. And so I put on my Mamba mentality and I said, let's go for it all. Let's not just look at this and replace some servers and do it in an incremental fashion. Let's do the whole thing. And the whole thing turned into us rewiring, re-networking, evangelizing our entire IT infrastructure. And we did that just before a pandemic hit. So put that added stress on us. We were able to work with Nutanix engineers, Citrix engineers, and make a good plan that in the end, I am happy to report that throughout the entire pandemic, Delaware Valley Community Health laid off not one person. And you can't do that if you don't have an information technology stack that is able to support what then turned into a hybrid staff, meaning half of your staff is in the office, half of the staff is at home. And if not for Citrix, if not for Nutanix, very poignantly, we would not be in business today. So I'm very happy. If anybody can tell, I'm very happy to be talking about this today.
We appreciate it. You're truly living that story in a mission critical industry, and you were able to modernize your infrastructure right before the pandemic that I'm sure paid significant dividends for you throughout the pandemic. Now, I do want to kind of touch on a couple points that you hit on, Isaiah, around IAPS and storage, general performance, your use of AHV. So I'll kind of throw this one to Jarian first. Jarian, talk to our listeners a little bit about the AHV differentiators, right? Performance and IOPS, and what you guys are really able to deliver for Citrix workloads.
Yeah, thanks, Alan. So AHV is our hypervisor. So when you go out and get the Nutanix stack, that's going to come with it. And so we have full integration with Citrix. We work together with plugins and so forth to fully be able to use Citrix Cloud or Citrix DAS or the on-prem control plane, and be able to pick your choice of provisioning, whether that's Citrix provisioning or machine creation services. And the way our software works is, our stack works is you start with a minimum of 3 nodes. They can be a mix of a hybrid storage node where it's a mix of flash and spinning disk, or it can be all flash with a mix of SSD and NVMe disk. All depend on your requirements, depends on what type of storage you're going to use. From there, we have our software on top of that, and you start with the minimum of 3 nodes, and then you build on like Lego building blocks. So you can start off with 3 nodes today, and then expand that 1 node at a time to be able to scale as you need. Start with what you need today, and if you start adding more users to the environment, start adding nodes to scale to what you need. The one thing we have in our software stack, because the way we build, is linear scalability. And that's just not marketing speak. That's what we do within our team at Nutanix, is we test releases of Windows, releases of AHV, releases of Citrix, and to make sure that if you get X amount of users on one node, that you get the same to node 2, node 3, and so forth. And that way when you have to scale, how many nodes that you need to add to the environment. Add things on that. We have things like built-in files for your profile solutions or for your user data. And then also built-in replication and recovery as well. And also if you need to have like a bursting scenario, like when Isaiah talked about going hybrid, they had the option to where if they didn't have the infrastructure on-prem, they could burst into the cloud using our NC2 Nutanix Cloud Clusters offering as well to get that bursting capacity if they needed to.
Awesome. So you guys really have the whole hybrid stack covered end to end. And I think that linear scalability is huge, right? The predictability of knowing as you need to scale up, right? And talking pre-pandemic, because we never know what the future may bring or what an M&A might bring or the next business requirement. So I think that's really huge.
Even weather-related issues as well. You never know. Storm's going to happen. Snow on the East Coast. A nor'easter might happen. So you need that capability to be able to provide those resources to users.
Absolutely. So speaking of users now, let's talk a little bit about a day in the life of a typical user, Isaiah, right? It could be a clinician or one of your healthcare workers. maybe you could run us through that. What does it look like when they start their shift, they begin accessing your IT systems, and maybe you could just provide a little color there for us.
Yeah. So we have two staff profiles. Again, we have one that may just walk into our buildings now that we are semi-open after being closed for many of the COVID time. We have a profile, a staff just comes in, sits down at their desk, they log into a thin client workstation that we configured, and then they access Citrix, and then they access all of their applications. Or there could be a provider profile where they're doing telehealth the entire day. So they are logging in through their own internet connection coming across our WAN into our Citrix environment that then is powered by the Nutanix hardware. And then they're launching all of their applications subsequent to that profile. And then we have the third profile, which is you can start at home or start in the office, and then you can reverse that. You can go home and finish your day, depending upon what we need you to do for our entire organization. So whatever profile you have now, where previously it was everyone coming into the office, so all I needed to worry about was my WAN and my LAN, now I'm having to worry about my WAN, my LAN, and your WAN as well coming into the environment. And so I'm very happy that I get better sleep at night because I have this infrastructure and know that I'm taking advantage of all of the things that both Citrix offers from the application perspective, and then from a Nutanix perspective, the same thing all the way up and through security, including their Nutanix Flow product, which is microsegmentation. So we're taking advantage of all the things that Jaron said. We're taking advantage of all of the application profiles that Citrix offers in terms of the machine creation services. So we're able to, because of this relationship, I have single points of issues, single points of successes, and then single points of we just being a great organization where all I need to know is that my team is making sure that everyone can get in where they get in. And so in healthcare, that is critically important because at the end of this, at the end of all of this tech, we can talk tech all we want. At the end of this, there's a patient on the other end trying to become a whole person. And so if from time to provider for a doctor is longer than it should be, then we have issues. And I don't care regardless of your ability to pay. I'm going to get a little philosophical here because that's our mission. My charge is to put in front of all of our patients technology that I think they deserve.
That's incredible. Such an amazing mission. And I want to double click a little more on telehealth and what you're doing there, and perhaps some of the challenges that you were able to overcome with your newly modernized Citrix and Nutanix infrastructure. I have to admit, I recently engaged in my first ever telehealth session just for a checkup, and I was like, wow, this is amazing, right? Like you don't have to like go into a waiting room or wait. And I think, right, that's a big part, from my perspective at least, of where kind of health and medicine is headed. So yeah, we'd love to learn more about how the infrastructure is really helping power that aspect of your organization.
That's a great question, Alan. And I'm going to say this, I'm going to get a little on my soapbox here because I'm just so excited. We had zero telehealth before the pandemic.
Wow.
Zero. And the reason we had zero, because as an urban FQHC, our reimbursement strategy was thought of, because we're urban, it was non-reimbursable for telehealth, meaning that we would not get paid for a telehealth visit. You throw in a pandemic on that where you have to close all of your doors, you have to do telehealth. So the emergency use authorization and all the public health emergencies unlock that ability for us to do telehealth. And so because of this infrastructure, in a week and a half, I was able to select, design, and implement a full telehealth solution to the point that we did 47,000 telehealth visits our first year. Wow. So we went from zero to 47,000. You don't do that on my old infrastructure. You do that on Nutanix and you do that on Citrix. And so just think about that and put it in context. And I know I'm preaching to the choir to everyone's here, but if we are unable to scale at that level from 0 to 47,000, you need the infrastructure to do that. The other thing about this infrastructure that we were able to do is that we were tapped by the White House, part of their health equity initiative, to do vaccinations. So we were part of the very first cohort to receive the COVID-19 vaccinations. One of the criteria was your IT infrastructure. Can you submit this data back to the federal government? And our answer was a resounding yes, because we had the infrastructure we did. So when we talk about health equity, when we talk about community health and the power of my role and my job to be able to have this infrastructure, we then were able to provide to those that really need it, not only testing, but vaccinations all the way throughout, and then submit that information to our local, state, and federal government so that we could play our role in the public health emergency. And I am just so happy with what our organization was able to do. And again, we kept every single employee in our organization, not one layoff. And you can't do that without technology.
Yeah, just an incredible story there. Incredible numbers from 0 to 47,000, was it? Like, that's just absolutely amazing. And so to power that, certainly from the Citrix side, right, we're delivering our HDX suite of user experience technologies, or ICA protocol, ensuring rich and engaging experiences across whatever type of app you're serving up. But Jarian, maybe you can kind of enlighten some of the attendees today around some of the networking aspects, right, that you've traditionally been able to provide across your stack, and how that could really help to power these kinds of solutions for customers.
Yeah, so Isaiah mentioned microsegmentation. So we do have a product called Flow, and that will help you, apply policies, have network visualization, and also be able to control, where users are able to talk to once they get into that environment. So it's going to help from a security aspect, but also from a visualization aspect as well. One thing I wanted to ask Isaiah as well, speaking of the infrastructure, how was your transition, your migration from physical coming onto Nutanix, and that time to value?
Yeah, so that was the best cutover migration I ever did in my career. We had to run parallel systems. Now, mind you, again, we started in 2019 with Nutanix, but we had Citrix. But in the midst of this, we were upgrading to the long-term stable release of Citrix. So we were doing multiple upgrades in a parallel fashion. And then when we cut over, this is how I knew it was successful. A provider, I had been messaging our organization, let them know, building that trust, building that buy-in. Hey, we're going to be doing this. We're going to be migrating over. We're going to make things a lot better. On day one of the migration, I got an email from a provider, and they said, hey, when is that migration happening? Because, I'm noticing some increases in my workload. And I said, it happened already. And they said, wow, it's like butter. Now, I'm just going to put that on my back of my wall here, because for a provider in a stressful situation to say they didn't even know the migration was happening and that it was like butter, that's all I needed in my feather in my cap. But then the other thing that I wanted to throw in there was the fact that we also instituted Microsoft Teams as a communication portal for us, because we had to shut everything down. And the integration of Teams and Citrix, and all we had to do was allow audio and video through the Citrix policies on the studio side. We don't be successful without all of these relationships. So for us to be able to say, okay, for Teams to be such an application that's video heavy, that's audio heavy, and to still be able to produce a quality experience, oh, come on, man. I wake up every day and walk in here with all of these feathers in my cap, smiles, and just happy to come to work every day.
That's awesome. Truly the IT superhero, right, of your organization. That's amazing. And it's great to hear that you're taking advantage of optimized Microsoft Teams as your unified communication solution, as so many of our customers do, right? You get that best of breed user experience through our efficient offload, so we can take advantage of Windows, Mac, Linux, Think Client endpoints, Google Chrome, whatever you have, but all that SIP signaling, right? The authentication, the chat logs, the data, all that remains secure, right, across your Nutanix infrastructure. So really great to hear you've got that all implemented. Okay, so switching gears a little bit, I'd love to learn more about specialty devices using different kind of peripherals. Traditionally, we see this quite a bit throughout healthcare, be it scanners, badge readers, barcode printers. What types of those devices are you using, and just kind of endpoint devices across your organization?
Yeah, anytime I get on a stage or a platform, I say it's time for us to get rid of the fax machines. So that's my public declaration. It's time for us to get rid of these fax machines. But to answer your question, without the joke here, we have all of those devices. We have personal scanners, we have corporate scanners, we have digital signature devices. We have all traditional healthcare peripherals that tie into, and again, our application layer is Citrix. So if they don't work in Citrix, they're not coming in our buildings or at the front desk.
Awesome, really good to hear. And so you have this environment set up, you've been running it for a little bit. I think a lot of times when I have conversations with customers, they're so excited about modernizing their infrastructure and what's involved to get there, but maybe they don't understand what does a day-to-day look like, right? What's the monitoring? How do we ensure that this environment is truly meeting business objectives and that we're managing costs? So let's talk a little bit about that in terms of how you monitor your Citrix Nutanix stack and how that's really helped to enable and empower you to meet business requirements.
That's a very good question. And me being the business executive from my team to our organization, I look at all of those. I have to meet our organizational objectives. I have to meet my departmental objectives that I give out to my team. And one of the things that my team enjoys are the day-to-day monitoring. So we can sometimes predict something that could potentially happen and jump on it. So I really challenge my team that in our evaluation of the long-term stable release of Citrix, the Nutanix infrastructure, is to evaluate the widgets, as we like to call them. And what we mean by that is, what does the front-end database look like? Can you see what you need to see to produce what you need to do? So we really have a great time, my team, and they tell me that they really like looking at the widgets on the Nutanix dashboard, and they also like looking at the widgets on the Citrix side, and they like the self-healing features that both of the organizations offer. So sometimes you walk in and we walk into an alert that happened overnight, but then a fix that happened overnight as well. So we love it.
Awesome. And I could just kind of see you itching to provide some commentary there, Jarian, as well, maybe about some of the Prism and your monitoring solutions.
Yeah, so built into our stack, we have our Prism products there, where you can do things like do runway detection, so you can see, if you need to upgrade your infrastructure, add more. Things like our insights, where you can call back to Nutanix. Other things too, where you can look at different graphs and charts to look at your CPU, your memory, and so forth. And then also do things like our Prism playbooks as well to kind of add that if this then that automation. So you see a VM that's possibly needs more memory, that's hitting a high memory threshold. You can add memory on the fly. You can add more disk storage if you need to. Increase the vCPUs and that kind of stuff too as well, to help you kind of scale up those VMs if you need to. And all that's built into our infrastructure, whether it's just Prism or Prism Pro Ultimate. There's all kinds of tools to help you get visibility in your stack, troubleshooting, monitoring, anomaly detection, and so forth, to help to make sure that infrastructure is running optimally.
That's awesome. I can't overstate that enough, how critical monitoring is to the overall success of an environment. And definitely from the Citrix side, right, we have you covered with our director/monitor tools, really understanding what's going on, how users are working, and then we could even take that a step further with some of our newer analytics capabilities to really see where are those bottlenecks, where are failed machines, overloaded machines, and ideally getting to a state where you're working more proactively instead of reactively. Really cool.
And just to add there too,
yeah.
You mentioned Director, we do have the integration between us as well, to where you can drill down to the machine level, see the individual VM storage performance to see if that could be a bottleneck as well, if you're trying to troubleshoot a performance issue.
Absolutely. We've got a number of great integrations across the teams. And just kind of on that point, Jarian, I mean, the thing about Citrix and Nutanix that I love is it's a great relationship where you've got experts on both sides that really, not only the product's integrated, right? The services and support are also integrated, right? You're among the elite of the elite Citrix technology professionals. I myself, I'm Nutanix certified. We've got plenty of Nutanix certified consultants and teams. So when you choose a Citrix Nutanix solution, as Isaiah has attested to here, you're really getting everything across the board, right? Great tech, great services, the end to end. So I did really want to reiterate that point as well.
And not only support and services, Alan, but we also have a biweekly engineering to engineering meeting as well. So that we work on a joint roadmap. We make sure that anything Citrix on Nutanix, all the integrations there, plugin enhancements, and so forth, and we continue to work on that between the product teams as well. One of the things that I like to be involved in to help out, make sure we fit our customer needs, and we're looking at what we can do to be moving forward as well.
Absolutely, absolutely. A great working relationship across many points throughout our organizations, definitely. Well, we've got a few more questions here, and then we'll get to the Q&A from our attendees here. I did want to reiterate, as Rubel mentioned earlier on, please feel free to submit your questions through the Q&A panel. We'd love to go through them, and we'll have some time to ask them. All right, so Isaiah, as we kind of start to round things out here, what are your tips, or I'll say recommendations, for how healthcare organizations, and maybe more specifically public sector healthcare organizations, can improve their IT environment? So what's, I guess, the best piece of advice you could have given yourself a few years ago that you can enlighten some of our attendees here today?
That's a very good question, because I always do a root cause analysis on my own self and my own performance. And also, I like to recommend and provide advice where whoever wants to listen, and it just so happens that I have a Citrix and Nutanix webinar and people can listen to me. So what is my advice? My advice is to not stop innovating. And what I mean by that is not to get so set and forget that you forget that technology continues to move. And sometimes in our healthcare industry, we're too far behind, in my opinion, of what is actually out there that could benefit our patients. And one of the things I'm so happy that's happening now since the pandemic is that we're really taking a strong internal look at our efficiencies, our process efficiencies, our operational efficiencies, our clinical efficiencies. And what we're finding is that technology plays a good mediator between both of all of those things. And what so happens is that if you have the right technology in, and then you have the right conversations when putting in this said technology, that you can be successful. For me, there's so many bells and whistles and features that excite me, but if that can't excite a provider who's actually doing the work, if that can't excite the front desk who's actually engaging with the patient, if these technologies, these bells and whistles, are just bells and whistles for your team, you will not be successful. The success comes from the buy-in, it comes from the collaboration across the aisles, and it comes from everyone understanding that we all play well together in this team of trying to produce whole people and whole patients. And so I'm very happy that I have strong relationships with my colleagues. I have strong relationships with our CFO, who had to pay for all of this. You know, if I just said I need millions and millions of dollars for this infrastructure and I couldn't articulate why, she would have said no, but she said yes. And so that yes turned into us spending capital, but then also keeping everyone employed, which was our CEO's goal from the very start of the pandemic. We're not laying anyone off, so we need to do exactly what we need to do to make that happen.
That's awesome. So sometimes the best technology part really isn't even a technology part, it's the people aspect, right? And understanding the business and relationships and really some of those, the workers that are making magic happen every day. Excellent. All right, so last question here that I'll throw it to both you gentlemen, and then we'll kind of jump into the Q&A. Where do you sort of see the future in terms of just technology in general amongst, right, hyperconverged solutions, VDI, DAS, as well as, right, the healthcare industry? I'll sort of give my take real quick. I feel like there's a lot more that's going to be done around machine learning, AI, and automation to work smarter and allow us to focus more on the strategic elements instead of sort of the day-to-day minutia or tactical areas. So that's kind of my high level opinion of where I think the industry is heading towards. But I'll send it to you first, Jarian, and then we'll have Isaiah wrap us up before we go to Q&A.
Yeah, thank you, Alan. I definitely agree on your take with AI and machine learning as well. For me, I'm looking at too is, it's becoming a hybrid multi-cloud world. You're not want to put all of your eggs in one basket, and being able to move between on-prem, public cloud, and different public cloud providers is going to be key to a lot of organizations to be able to, get through any issues or outages and be able to easily transition between those.
Excellent. Thanks, Jarian. And Isaiah, what about from your side, just in general or within healthcare?
Yeah, I'm going to agree with both you, Alan, and you, Jaron, that this hybrid way of operating is here to stay, and that we really need to really figure out ways to play well with whatever the patient may need in healthcare's perspective, but then also what the staff needs, and know that the profile is not the same that it was just 2-3 years ago. That everyone expectation of technology, everyone expectation of the business operating is hybrid. And that if you do not have the modalities that can reach them where they are, then you are going to be some of the businesses that fall into that M&A category. And so I really strongly believe that our positions, or my positions as CIOs and all tech leaders, is that we really have to make sure we're at the table, having the conversations directly when they need to have. I'm so lucky that I report directly to the CEO. So I sit at every meeting, and so I get to throw that context of technology that, yes, we can do this, or we can't do this, and here's the reasons why. Because in my opinion, our role is understand the entire business, because we have to, because of the data, because we know what software, we know what hardware is instituted in our organizations. And if we are able to continue that, I think that understanding where the organization is going plays a strategic role for us. So I wrapped all that up in about 2 minutes, but that's really where I think we are starting to see in the future.
Excellent. Very well said. And with that, Rupal, I think we'll go ahead and turn it your way to help us out with the questions that were entered into the Q&A panel.
Absolutely. And thank you so much, Alan, Isaiah, and Jarian. I think it was an insightful chat. Let's see what the audience have for us. So ladies and gentlemen, if you have any questions, please feel free to type them. If you're feeling brave enough to come and talk about it, you can also raise your hand, and I'll give you permission to unmute, and then we can take it. So I have a few questions coming in.
Yeah.
Okay, this one's for you, Isaiah. Are you currently using GPUs to power your workloads? If so, can you describe that a little?
Yes, we're currently using GPUs. So the way that I like to talk about the GPUs is that it's efficient and getting us from point A to point B. So a lot of our algorithms behind our GPUs are really from a use case and a business use case perspective. We're not doing it across the board. We're targeting specific areas of our business where we may have a staffing shortage, or we are lacking in the interoperable technology. So we throw those GPUs in there, and that way we can say, all right, you can take this chunk of the network, this chunk of the space, this chunk of the virtualization, and we can monitor it and add and subtract some of what Jaron was talking about as necessary. So we go from a business use case scenario, not necessarily the entire organization.
Gotcha.
Awesome. I'll just add to that real quick. Rupal, we're on weekly calls with the NVIDIA team. I'm on regular calls with AMD. So from the Citrix side, we're very well connected, and GPU support is a big focus area for us. And Jared, I don't know if you have anything to add to that, but yeah.
Yeah, us as well at Nutanix. So we have GPU enabled nodes that we have. We're big into NVIDIA, the newer nodes supporting the T series and the A series GPU. So we're all there today, and looking forward to what NVIDIA does next with GPU, so we can continue to innovate with them on our stack.
Awesome. Thank you so much for that, Jaren. Isaiah, there's another one. The gentleman is asking, I understand you're primarily on premises today. but are you thinking of cloud at all for any of your workloads?
That conversation has accelerated in my mind, in my strategy and vision since the pandemic. And what I say to my team is that it's time for us to dip in the water. And so we're on a path of this hybrid cloud and on-prem solution. And I'm happy that we are making this cloud with these strategic partners, because I feel so comfortable with them that I feel comfortable that they are in the cloud appropriately. For me as a CIO, I'm very big on security. I'm very big on it not affecting patient care. And then we still have complete access to what we need access to. So the fact that I feel comfortable with Nutanix, I feel comfortable with Citrix, we are in a hybrid mode and will continue to be hybrid and make further investments into the hybrid infrastructure. Yeah.
And just to add from Nutanix standpoint, that would be our cloud clusters offering, Isaiah?
Yes.
And then for those of you who don't know what our cloud clusters offering is basically we're taking AHV and running that in bare metal nodes in the cloud. It's live in AWS with 5 different node types, including a GPU node type. And we will have a few different node types in Azure, which is, pretty much at the finish line. We have customers in preview now, so be able to just take and using our built-in protection, our DR orchestration, and be able to move things seamlessly back and forth from on-prem to the cloud. That's all what cloud clusters is about, and that's going to get you easily time to value with that as well.
Definitely. And from the Citrix side, we've got that cloud-based management plane in Citrix Cloud, our Citrix DaaS service. So we abstract all that, we take care of it, we keep it evergreen, and we allow you to focus on your resource locations, right? So this could be Nutanix solutions on premises and or Nutanix clusters in the cloud, seamlessly integrated. So you've got that single pane of glass for both admins and for users.
Awesome. And there's another one. I think this came earlier, Jarian, when you were talking about 3 nodes. So the question is, how many end users does 3 nodes support?
It all depends on the workload profiles. GPUs are not GPUs because today GPU is kind of the limiting factor of users per node because how many slices you can get on those GPUs and what kind of profiles you're using. So it all depends. On our portal, we do have reference architecture guides where we use logon VSI, knowledge worker profiles, power user profiles, and we go through that testing to show, we're seeing 130, say, for Windows 10 on NC2 or Nutanix cloud clusters and AWS. But if we change that profile to a power user, we show that all that data is there, but it all comes down to what the actual workload profiles are and what they're doing. One customer could be doing 50, one customer could be doing 150. It also depends on the underlying hardware as well. We're seeing with AMD with the higher core counts that you can get a lot higher users per node. Also with our the newest Intel series, that's catching up to as well. But then you get into that conversation of, do I want max density or do I want better failure domains, right? Do I want a smaller failure domain or a larger node count? So it all depends on there and how you build that out and what your risk of tolerance is.
Gotcha. There's one for you, Isaiah. Which hypervisor do you use on Nutanix cluster? And can you sort of throw some light on how and why you chose that?
So the question is, which hypervisor are we using?
Correct.
So we went all in with Nutanix. So we said, hey, we're just going to do everything Nutanix. We're going to do everything Citrix and just be that unified and that focused on which hypervisor we are using. And so that is where we are right now. We're taking advantage of AHV, and I was blown away with the speed capabilities of AHV using Citrix. So we're very singular focus again on Nutanix and Citrix and the relationship that they play. I didn't even know about the engineering calls because I'm seeing the direct benefit of it. So I'm glad that they're having because I'm seeing the direct benefit of that collaboration. So that's the hypervisor we're using right now, and we replaced what our old infrastructure was.
Awesome. Alan, this one's for you, perhaps. Is there a way to extend the already existing Citrix on-prem infrastructure without using Nutanix clusters on cloud?
Yeah, so there's a number of ways that you can architect your solution to extend to cloud, right, to burst to cloud, take advantage of various cloud technologies and resource locations across the hyperscalers. The short answer is yes. I'd encourage folks to check out a lot of great resources that we have on TechZone, selfishly, that my team looks after. So techzone.citrix.com, also the main documentation, docs.citrix.com, and we've got great videos as well on our YouTube channel.
Awesome. Thanks so much, Alan. I think we are right at the end of our time for this webinar. So ladies and gentlemen, if you do have more questions, please feel free to shoot them at citrixready@citrix.com, and we'll try and get them answered by the 3 individuals that you see on the webinar today. I'll find a way for them to respond to you over email. With that, I think thank you so much. As I promised, every 10th attendee on this webinar will get an Amazon Echo Dot. So just watch out for an email from Citrix Ready, and if you get that email, it means that you're the lucky 10th one. And once you respond to that email, we'll get the gift shipped to you. Coming back to our audience, coming back to our speakers, thanks so much, gentlemen. It's been a pleasure. Any final words before we call it up?
I'll have one final word, and that word is sometimes technology vendors don't understand their impact to a business. And I just want to say that this relationship has had a direct impact to our patients who need it the most. And so I employ all vendors kind of to have the same similar open door policy. And I won't get into all the business case, but I really want to stress that those that are purchasing, like me, we want to make sure that our vendors at least can have a conversation with each other, because at the end of the day, we're trying to produce an outcome that has a major effect. And in healthcare, that's a life or death situation. So if I can call Citrix and Nutanix and they both can talk to each other, that makes my job a lot easier. So I want to thank Citrix, I want to thank Nutanix for their partnership, for their relationship, because me on the provider side, I'm a direct beneficiary of those levels of conversation. So thank you again.
Awesome.
Thank you,
Jarian?
Isaiah.
Yeah, thank you, Isaiah. I just want to say thank you, Isaiah, for coming on today and talking with us and talking about your infrastructure with Citrix and Nutanix. And thank you, Citrix, for having us. And any questions or anything about Citrix on Nutanix, feel free to reach out to us. Feel free to reach out to you directly. Always happy to help, and look forward to our continued relationship and what we do in the future.
Thanks,
Definitely.
Jarian. Alan?
Yeah, I'll just echo everything that's been said already. It's truly been a pleasure and privilege to help moderate this fireside chat. Thank you so much for your business and partnership, Isaiah. Jarian, always good to see you and be able to present with you. And what we have together, I think, is special, as Isaiah pointed out. And it's an amazing story to tell and keep telling as it continues to evolve, right? As we have the next chapter of how we can power modern work with proven hybrid cloud solutions, no matter what your business challenge may be. So it's really exciting to be part of it. And yeah, thanks all around. Really appreciate it.
Awesome. Thank you so much, gentlemen. And again, ladies and gentlemen, a huge thank you for taking the time to attend our webinar. This is Rubal Walia signing off for now, but see you guys on the next webinar. Bye.
Bye.